Hello, my name is Dr. Robert Mihalich, and I would like to provide you with an overview of what to expect when undergoing and recovering from surgery for an ankle fracture. Many ankle fractures we see are non-operative, but unfortunately some will require surgical fixation to ensure a good outcome. The procedure to fix ankle fractures is referred to as open reduction internal fixation. It generally involves making an incision and manipulating the bones back into position. The bones are then secured with either a plate and screws or just screws. The screws are typically stainless steel or titanium. The number of plates and screws can vary depending on the extent and complexity of the fracture. Prior to surgery, plan to take it easy and minimize any commitments and responsibilities. It will be imperative to elevate the leg for the first 2 weeks whenever resting. There will be something on your leg for 6 weeks. It will be a splint, cast, or boot, or all three depending on the fracture type. Submitting paperwork for time off work prior to surgery will decrease the chances of your benefits being delayed. Time off work will vary depending on the type of job you have. Desk jobs may require only 1 to 2 weeks off, while a job that requires heavy labor or prolonged standing can take 3 to 6 months to return. On the day of surgery, plan to arrive 1 to 1.5 hours prior to surgery. This may require planning to avoid the ever-present traffic construction in Michigan. You will meet with nursing and anesthesia upon your arrival. Anesthesia is typically a general anesthesia and a nerve block for postoperative pain, and it is usually recommended. This can provide pain relief for up to 24 hours. I will meet with you before surgery to mark the leg and answer any last-minute questions. Surgery averages 45 minutes to 1 hour of operative time. After the surgery is complete, you will be placed in a splint, which is a padded plaster form of immobilization that cannot be removed. Depending on the severity of the fracture, you may alternatively be placed into a boot that could be removed for sleeping and rest. The boot is usually used for a stable fibula or lateral malleolus fracture, which is the bone on the outside of your ankle. This fracture is secured with a plate and screws. This will restore the length and alignment of the bone. The inside part of your ankle is called the medial malleolus. This fracture is usually secured with 2 screws. When both the inside and outside bones are involved, a plaster splint will be used after surgery for the first 2 weeks. The goal of this surgery is to perfectly align the bone so that the ankle joint is restored and the chance of arthritis in the future is minimized. Ligaments join bones together. There is a ligament between the tibia and fibula that is sometimes damaged and requires fixation. This is done with a very strong suture called a tightrope, which is a brand name for this device. It will hold the bones in alignment while the ligament heals. Recovery in the PACU is usually around 1 hour. You will be discharged home once your pain is controlled and you are safely mobile. Most of the fractures we do surgery for involve multiple bones and will require the patient to be non-weight bearing for the first 2 weeks after surgery. This will require crutches, a walker, or commonly a rollabout or kneeling walker. Some less severe fractures may allow the patient to fully weight bear immediately after surgery. Elevation is the most important for wound healing and swelling control. Icing and pain medication as needed will be used for the first few days frequently. The dressing will need to remain dry and intact until follow-up. There will be no need to change the dressing, and you should use a well-sealed plastic bag or commercial cast cover for showering. Follow-up will be at 2 weeks for suture removal and x-rays to ensure the alignment has been maintained. We will discuss the progression of activities, a home exercise program, and return to work. In most cases, you will be placed in a boot and allowed to progress your weight bearing as tolerated. The next follow-up is usually at 6 weeks after surgery. Physical therapy is recommended and initiated at this point. Physical therapy will help you to return to your activities faster and provide confidence and reassurance as you progress. After 6 weeks, you can return to all activities as tolerated. Typically, swimming and biking can start now. Walking for distance can take 3 to 4 months. Running and return to most sports will take 4 to 6 months. Swelling will be the last thing to resolve and can take all the way up to 1 year to be where it's going to be. Any fracture, whether it requires surgery or not, takes 6 months to fully heal and for patients to return to normal function. This tends to be longer than most people think and requires patience to get through this injury. The hardware that is used does not ever need to be removed. However, some patients will have the plate and screws removed if they become bothersome either from their prominence or a feeling of stiffness. The minimum time for this is typically 6 to 8 months after surgery. I'm sorry if you are having to endure the recovery from an ankle fracture surgery, but know that we will be there for you every step of the way.